Good morning, respected Dr. B.N. Gupta sir, chairperson on the dais, my beloved colleagues in the audience. This morning, I just like to tell you this particular latest community eye health careness model adopted by Association of Community Ophthalmologists of India, Acoin, Acoin Drishti Rath Yatra. The partners in our journey is nobody else than Government of India and the state government under the National Program for Control of Blindness, as well as the Lion Sight First program. Along with them, we are marching all over Indian subcontinent to reach our goal of advocacy in community eye health. Our mantra is very simple and has been taken by the words of Swami Vivekananda: arise, awake and attain, and then succeed. All of you know that Association of Community Ophthalmologists of India is working for the last 23 years towards advocacy in community eye health in Indian subcontinent. But still there is the wall of barrier. What is that barrier? That is the communication gap. If you go to any village right at this moment, you can see at least a couple of blind cataract patients who require surgery right now. Every third or fourth Indian village has got one blind child who requires blind school education. On the other hand, if you go to the hospitals, you see a lot of beds are lying vacant for cataract surgery. An horrible scenario is there in the blind school where only 25% seats are full, 75% are going vacant. Why? Because of the ignorance of the community about available community eye health facilities in their vicinity. That's why we the Acoinians has taken this Drishti Rath Yatra to make the people aware of all these facilities, where to go, how to go, when to go, and who will accompany you. The Acoin movement was started 23 years back towards advocacy in Indian subcontinent. With this advocacy, we went to Odisha, we went to Kashmir, we went to Nagaland, we went to Chinese border of Arunachal Pradesh, we went to remote areas of Tripura in Myanmar border, Manipur, Assam, every unapproachable areas to examine the people, to go on with survey and to give them proper advice, direction, where to go, how to go, to get the best possible eye health care facilities. We underwent so many beautiful surveys in the past in those remote areas of Nagaland, Mizoram and Tripura, Andaman, Nicobar, everywhere. But right now, for the last 5 years, we have taken up this Drishti Rath Yatra. Here is a vehicle which is decorated with all the slogans and the preventive eye care measures for major eye diseases which can give rise to blindness, maybe curable or incurable. Our major agenda is against childhood blindness, diabetic retinopathy, glaucoma, corneal blindness, as well as motivation towards eye donation, and refractive error, as well as make the people about crossed eyes and its management. Keeping these things in view, the first Acoin Drishti Rath Yatra was started in the year 2018 from West Bengal. And then we started Drishti Rath Yatra in 2019 in 4 phases in 4 areas of Uttar Pradesh. And we have started from Kashi Vishwanath Temple of Benares Hindu University and started our journey from Jaipur village, which is the Prime Minister's adopted village around 40 kilometers away from Varanasi, Uttar Pradesh. Then this Jatra from Varanasi went to Mirzapur. From Mirzapur we went to Prayagraj, Allahabad. From Prayagraj we went to Jaunpur. Then we stopped our first journey in Jaunpur. Everywhere we like to have a rally with a meeting with the resourceful person like Lions, Rotaries, Medical College and others, as well as school children symposium for the school students and interaction with villagers. In the second phase in Uttar Pradesh, we started from Moradabad, C.L. Gupta Eye Institute, Moradabad, beautiful symposium with the resource person there, and then we have got a rally. From Moradabad, we went to Pilbhit, Kaushalya Devi. From Pilbhit, we went to Bareilly, where we had a beautiful meeting with the IMF doctors as well as other resource person. From there, we went to Rampur in Uttar Pradesh, and we stopped our journey at Meerut in the second phase at Meerut Medical College. Then we had Acoin Drishti Rath Jatra in Chhattisgarh in 2021 from Raigad. We had the Drishti Rath Jatra in Rajasthan, starting from All India Institute of Medical Science, led by Professor Kavita Bhatnagar in 2021. We have Drishti Rath Jatra in Andaman and Nicobar Island in the year 2022 in Port Blair with the kind help of Mrs. Lal and other ophthalmologists and benevolent personalities and the corporation of Port Blair. In Anantnag district of Jammu and Kashmir, the terrorist affected areas, we have gone through the Drishti Rath Jatra in 2022 and carried out even door-to-door eye examination in search of pseudo-exfoliative glaucoma and others in the apple orchards and others. Then our third phase in Uttar Pradesh started fifth phase started from Gorakhpur district in Uttar Pradesh in October 2022. Then we went to the adjoining Nepal in Bharatpur district in Nepal. During the Eastern India Zonal Ophthalmic Conference, we had gone through some districts of Bihar in Patna in particular. In Madhya Pradesh, we had been to Sagar district. We have done in Sagar district. Then in Andhra Pradesh, we had been to Eluru district with our Drishti Rath Jatra. As well as in Punjab during the North Zone Conference, we had been to Gurdaspur district. Then we went to Amritsar district, and lastly we had been to Jalandhar district. We had been to 3 districts. Everywhere we picked up some of our Acoinian friend who was the leader to go through all these programs, whether rally, interaction with villagers or school children checkup like this. In 2022, we had been to some districts in Odisha. We had been to Bargarh district in Odisha, then in Sambalpur district in Odisha. I must admit the captaincy of Professor Gunasagar Daso in organizing this Sambalpur district, the Drishti Rath Jatra in a best possible way. Following that, we had been to Karnataka, mainly in North Karnataka. We had been to in 2022, where under the leadership of Dr. Srinivas Joshi, we had ventured around 5-6 districts of Karnataka, in Belgavi district, in Gadag district, like this. On 23rd January 2023, on the birthday of Netaji Subhash Chandra Bose, it was a great occasion for us that the governor of Madhya Pradesh has flagged off Drishti Rath Jatra in Bhopal. And following that, we had got so many other Drishti Rath Jatra in Chhattisgarh, in Ghaziabad district of Chhattisgarh, Raipur district in Chhattisgarh. In Andhra Pradesh, we had been to Vizianagaram district as well as in Visakhapatnam district here also. And there is a wide publication of all these programs in different local newspaper. To talk about Visakhapatnam district of Jatra, I must admit the help of one Dr. Murli Krishna, who is a general physician, but very much attracted with our Drishti Rath Jatra. He has organized so beautiful camps, especially with the fishermen colonies on the seashore. These fishermen colonies, they have been empowered with the knowledge of prevention of blindness program. So in this way, we are going on with this Rath Yatra. Then again we come back to Chhattisgarh in Bilaspur district, in Mungeli district, in Kabirdham district, in Boitalpur in Mungeli areas. We have done maximum in Chhattisgarh. We have covered almost 17 districts of Chhattisgarh in that way. And in Sarguja district, Korea district in Chhattisgarh. So in that way, we have ventured around 62 districts of India by this time. But we have to go to 740 districts, long way to go. In the meantime, we have Drishti Rath Jatra in Bangladesh also. In March, we had been to Gopalganj district in Bangladesh, and we gone through the Drishti Rath Jatra in different areas of Bangladesh. This time, on 11th of February, we are again planning to go to Bangladesh for Indo-Bangladesh Friendship Mission with a big CME there. I invite all of you to be there in Bangladesh. And in Haryana, Rohtak, on 1st and 2nd April, we have got Drishti Rath Jatra. And lucky enough to be in Nepal for the last 3 days on the occasion of the Silver Jubilee of Nepal Ophthalmic Society. And I have passed the World Sight Day in Viratnagar, Nepal on 12th of October, and take the privilege to have Drishti Rath Yatra in the Sunsari district of Nepal, and day before yesterday in Morang district of Nepal. 2 districts we have covered. Here is a view of our World Day observation and Drishti Rath Yatra in Sunsari district, Viratnagar, Nepal, where we have a beautiful student symposium and a rally. In this particular way, this Rath Yatra is going on, and we have to venture all the districts of Indian subcontinent to make the people aware of the existing eye health care facilities. Make our awaj for community eye health to echo everywhere, as the Kirtan of Govindaji temple Imphal in Manipur is going on for centuries together, endlessly, round the clock, and the awaj is going on. Let the lamp to light lifelong, as Gangaruti at Rishikesh is going on for centuries together. So in that particular way, we have to keep up the light of Acoin to light everywhere in Indian subcontinent. Please be a member of Acoin, enroll as a life member of Acoin, and join in this journey. Thank you very much.
Thank you, Shobhanda. As usual, we have given a beautiful overview of the different activities going on under the banner of Acoin. So now, may I invite Dr. Ajay Kumar Singh. He will be highlighting the program going on in Odisha, in particular Drishti Rath Yatra. Dr. Ajay.
Good morning to everybody, respected Gupta sir, Sapan Samant sir, Mathur sir. As a part of Acoin, in November 26th, our Odisha State Ophthalmological Society conference was going on. At that time, by the help of Sapan Samant sir, we have done 4 to 5 activity in Acoin in the interior pockets of Khordha districts. First we have done Dishti Ratha Jatra, that is in 26th November. At 8:30 a.m. we have flag of the Dishti Ratha Jatra in a prominent place of Bhubaneswar. For that we have done 70 to 80 rally, a bike rally, taking the help of ophthalmic assistants, villagers, NGO hospitals and medical representative. And we have started from our venue of conference Odisha State Ophthalmic Society and up to Sai Temple towards Puri, near about 10 kilometers, and came back with the help of police personnel and also our staffs. And before going to detailed discussion, on that day we have distributed near about 2,000 to 3,000 leaflets of minimum 10 common messages, which was advised by our sir, Sapan Saman sir, and we have distributed 3,000 leaflets to the public during this rally. And these 10 points I have just mentioning that in Odia language we have given to the local public: wash your eyes daily with plain water as many as possible. This was the first message. Second was take green leafy vegetables, yellow fruits and vegetables, egg, milk. In this way we have written 10 points. Remind every diabetic patient to undergo examination of their eyes every 6 months. Encourage every individual above 40 to have their vision, intraocular pressure and retinal checkup once in a year to rule out glaucoma. It is must for every premature child to undergo retina checkup within 15 days of delivery. And don't neglect to take every child to vision and ocular position checkup, and if required, encourage to use spectacles. Don't burn, worry or waste the eyes after death. Donate the eyes for corneal transplantation. Contact for hospital corneal retrieval program. Always remember, in managing mature cataracts, there are nothing else than surgery with intraocular lens implementation to restore vision. And contact any ophthalmologist or ophthalmic assistants at an urgent following any ocular injury. Delay in reporting and treatment by traditional healers may lead to incurable blindness. And ultimate last, send the incurable blindness to nearby blind school for proper education by Braille or integrated system, as well as for training on community-based rehabilitation. And contact the nearby primary health center or ASA worker, public health nurse for further details to avail all the facilities at free of cost. So, these were the 10 messages written in the Odia and distributed during this program. And after the rally, we have gone one HWC, means Health and Wellness Center and Village Temple Terrace. A motto of the eye health sensitization in rural villages is a crucial endeavor aimed at raising awareness and ensuring the well-being of local communities in many remote areas. Access to adequate eye care and information about maintaining good vision can be limited. By initiating eye health sensitization program, villagers can learn about the importance of regular eye checkup, proper nutrition for eye health and the prevention of common eye conditions. Along with motorcycle rally at morning, there was also sensitization meeting at higher secondary school about community eye health program. Near about 150-200 students were there, and their sir and myself and headmaster of that school also present, and they were sensitized, and also prize given distributed to the students as a first, second, third, those who have received this received these messages, and they individually told what they learnt. Promoting eye health sensitization at the higher secondary school level is of paramount importance. Adolescence is a critical period of development, and students in this age group often engage in activities that can strain their eyes, such as prolonged screen time and extensive reading for academic pursuits. Educating these students about the significance of eye health proper vision care and the importance of regular eye checkup can go a long way in preventing potential vision problems in the future. By raising awareness about the impact of digital devices, maintaining appropriate lighting conditions, and implementing regular breaks during screen time, students can learn habits that protect their eyes. Moreover, knowledge of eye health also emphasizes the connection between eye health and overall well-being, reinforcing the need for a holistic approach to one's health. Sensitizing higher secondary school students to eye health is an investment in their future, ensuring that they can enjoy a lifetime of clear and comfortable vision. Then we went to one health and wellness center that is called Kako Rudrapur under Balakati CSC of Khordha districts, and there was a meeting, and as these pictures, all these ASAs present at their sub-centers, and Mahila Samiti and also other members were also present. And Drishti Rathayatra is an exemplary sensitization program aimed at promoting eye health at the grassroots level, where the engagement of community health workers plays a pivotal role. These dedicated grassroots health workers are the unsung heroes of our healthcare system, working tirelessly to ensure that the importance of eye health is understood and embraced within their communities. Through the Drishti Rathayatra initiative, they receive specialized training and resources to become ambassadors for eye health awareness, equipped with knowledge about common eye conditions, prevention strategies, and the importance of regular eye checkup. These grassroots health workers play a vital role in disseminating this information among their communities. By doing so, they help to bridge the gap between underserved populations and essential eye care services, ultimately contributing to the preservation of vision and the improvement of overall public health. And another meeting was done on that day at Jagannath Temple Terrace, and all the on the same village, and the prize also distributed by the SAR and all the ASAs and also workers. These initiatives not only help in early detection and treatment of eye problems, but also empower villagers to take proactive measures in safeguarding their vision. By fostering a culture of eye health awareness, rural communities can reduce the burden of preventable blindness and significantly improve the quality of life for their residents, enabling them to better participate in daily activities and contribute to their communities. Along with that, on 25th June 2023, a state level meeting has been done at Khordha District Town Hall of Odisha, where eminent personalities like ophthalmologists, doctors from and across India, along with local MLA, CDMO Khordha were present. Ophthalmology students from the different medical colleges were also participated and presented their research on eye health. And Sir addressing the gathering in this 25th June as Acoin Odisha State Chapter, and so many national level ophthalmologists also present in this meeting. Respected CDMOs are also there in the dignitaries. The national level Acoin meeting, which brought together ophthalmologists from across India and medical students, is of paramount importance in addressing the nation's eye care needs. With India being home to a vast and diverse population, eye health concerns are widespread, and the meeting served as a platform to disseminate knowledge, share best practices, and collaborate on strategies to improve eye health on a national scale. Ophthalmologists, as experts in the field, were able to exchange insights on the latest advancement in eye care, discuss the challenges faced, and brainstorm solutions for providing accessible and high quality eye care to all segments of the population. Moreover, the involvement of medical students not only fostered their professional development, but also infused fresh perspective and enthusiasm into the field. By coming together, this meeting not only promoted excellence in eye health care, but also contributed to the overall well-being of countless individuals, as healthy eyes are an essential component of a productive and fulfilling life. It cannot be outlined the efforts of the staffs of Khordha District's Eye Hospital, who contributed their best for making this program successful. This is our staffs and dedicated staffs of our Khordha districts. Thank you, Jai Jagannath.
Thank you, Dr. Ajay. Dr. Samanta, your comments, please. So I think
Only one word I can say. Dr. Ajay Singh is dynamic, Acoinian, in Odisha. Under his able leadership and a public eye health ophthalmologist, 100%. In India, we can find out only one Ajay Singh, who is all the time
have already witnessed that in Khurda meeting. Thank you, Ajay. So, nobody else is there, I think. Please conclude the meeting. Dr. Mehul Shah is there, our great leader from Dahod.
I can tell only one thing. We have the proud privilege to have Acoin, who's our state chapter meeting in the beautiful hospital in Dahod under the captaincy of Dr. Mehul Shah. So now, we would like to have a couple of lines from Dr. Mehul Shah. What is the idea for Acoin activities in Gujarat in future? Can you just give a couple of lines of your thought? In which way?
I think more coordinated efforts are required. Everybody is doing activities, but that's what I think. So, if more coordinated efforts are there, then the effect will be much better.
So who can crystallize this? So who is the person in Gujarat who can crystallize this coordination? Right now we have entrusted Dr. Rohan Chariwal.
Right.
But who are one of the great leaders that are Madam Sia? But who are on the other hand of Gujarat and he is on the other hand. So how whole Gujarat can be entangled? What's your suggestion? Then
Difficult to answer this question.
and one important thing, Dr. Mehul, for you, because you are a dedicated person of ocular traumatology, and this time you will be very happy to know that in our grand body meeting in last week, we have adopted ocular trauma as a subject of our discussion, ocular trauma in the community eye health practice. The annual discussion. This year, all our discussion everywhere in India and abroad will be centered only on ocular trauma, whether in our state chapter meeting, whether our international CME, and even in Puri in our annual conference.
We can support our resources if you wish. We have
Yes.
people in all the states across who are trauma experts.
Yes.
They can be important resource person.
So Dr. B.N. Gupta is also in our national managing committee. So we can make a task force under the captaincy of Dr. Mehul Shah, who can guide us what chapters should be discussed in each and every state level, zonal level, or at our national level on ocular trauma. Because so many papers are coming, and otherwise, one more thing, we don't like to keep ourselves engaged only within the discussion within these four walls, because we community people, we have to go to the field. So what are the sectors we can go on with operational research?
There are many because our rural sector,
Yes,
the ocular trauma is neglected since there are two eyes.
yes,
And till there has reason, people do not consider very seriously the one eye ocular trauma.
yes,
When patient go to hospital for some other reason, then accidentally people find out
the other eye is
that
lost.
this trauma has caused the problem. But
Yes, that's
maybe
why.
all neglected trauma are the biggest
That's
problem
why.
for us.
That's why how beautifully our Acoin activities will be an exemplary in the field of ocular trauma if we go on with some operational research, field research, and make some publication, worth not in the sense of my academic promotion, but worth for the benefit of the community.
I think all across the country, in all our Indian journals,
No, we
There
have
are-
to. I think we have to identify the different
Yes,
types of
that's-
trauma,
yes.
like agricultural trauma, industrial trauma, and this.
No,
So,
that-
as for example, in our area, in the
Yes.
Dhanbad coalfield area and that area, we get too many cases of ocular trauma very often,
Yes.
and there are some occupational hazards also, and different types of trauma,
Yeah.
irrigation, like so. Other places where the agriculture is the main agricultural trauma. Likewise, we have to go in the community and do survey work.
Yes, you will be happy to know that right at this moment, Dr. Poonam Khetrapal, who is the regional director of Southeast Asia, she has given this occupational hazards in blindness as the chapter of discussion for this particular year. So I think Dr. Mehul and Dr. Shreya can give us some ideas in which ways we can go out with all these research. But I just like to emphasize that this research should not be within the book with our only academic promotion, but that should be of some good help to the community at large.
Let us have a Zoom meeting with the chairman scientific committee, yourself,
Yes,
and the
yes.
and managing committee members, and we will just chalk out the strategy how to proceed further. I think
Yes.
that will be the good idea, because we need to go to the community, and then only we
Yes.
will be able to do our job
Yes.
properly. Okay, just sitting in the
Thank you.
four walls will not serve you.
Thank you.
So, thank you very much. So, thank you, the speakers. Thank you, Dr. Saponda. And I think with this, I end this session and hand over the stage to the hall coordinator. Yeah. Thank you.